first exercise of the lower back mobility series is lower back extension in prone position. What we do for this particular exercise is we gently position ourselves up onto our forearms into a sphinx position. We are holding this particular exercise between 5 to 10 seconds and gently releasing and coming back down into a relaxed position. The next exercise is lower back extension in a kneeling position. This is a variation of the previous exercise you have just seen. You are holding it for the same amount of time, between 5 to 10 seconds, and gently coming back to a relaxed position. This is if you find it difficult to lie on your tummy, or you're still experiencing quite a lot of pain into the lower back. You can gently ease into this position and relax within your own limits. The next exercise is lower back flexion. For this exercise we want to start by putting the chin to the chest and following the movement down to the floor. Again, nice and slowly and gently. Flexion is one of the principal movements of the back. If you're suffering from stiffness or rigidity, it's important to regain the full range of motion into this vector in order to regain full mobility of your lower back. We're now moving on to lower back side bending. For this particular exercise, what you want to do is take your ear to your shoulder and follow the movement down the side of the body. We're going to hold at end range for a couple of seconds and then gently come back up to neutral. With this exercise, it's important to repeat it both sides. Similar to flexion, we want to regain the side bending element movement of the lower back in order to regain full range of motion and mobility. The next exercise is one of my favourite exercises for decompressing and moving through that lower back. What you do for this particular exercise is you're keeping your feet on the floor, gently swaying the knees side to side. Not only is this encouraging blood flow to the area for repair into the lower back, but also is allowing relaxation of the paraspinal muscles that tighten up, particularly with stiffness into the lower back. Keep doing this movement for 45 seconds. The next exercise is called the deadbug. This is a key exercise for regaining core strength and stability, not only post-injury but also if there's a chronic history of stiffness and restriction into that lower back. How we conduct this exercise is we go onto all fours, gently lifting up the leg and lifting up the opposite arm. We're holding this between 2 to 5 seconds and gently coming back to the midline. Repeating this exercise 10 times on each side, ensuring that we're not overarching the back and keeping the core tight and braced the whole time. The next exercise is single leg knee hugs. What we're doing with this particular exercise again is decompressing the lower back, but also stretching around the pelvic musculature that typically become tight with lower back stiffness. What you're going to do is repeat on both sides, holding for a couple of seconds into the tummy and then gently relaxing the leg down. Repeat this exercise 5 times on each side. If you feel comfortable, bring both knees up to your chest and gently hold it into that position. What you can do in addition is you can rock side to side. What this does is it encourages more blood flow to the lower spine, but also can add more decompression to relieve pain.